It's a national health care crisis. There just aren't enough doctors in our country.
Another state, another doctor shortage. This time it's Florida.
We have some counties in Florida that don't have any physicians practicing in them.
We're going to need 4,500 more primary care physicians in Florida, and we're just not going to have them.
Because primary care physicians are paid so poorly relative to the glitzier medical specialties, medical graduates simply don't choose primary care anymore.
But it is access to doctors that will vex Americans in the future.
I'm one guy. We need more people.
The availability of primary care doctors in Florida is grossly inadequate.
The problem will be even worse for rural areas.
50% of emergency room visits occur because of poor access to a primary care physician.
You have a lot of medical doctors that come out here?
No, I have a problem with that all the time.
There aren't any physicians.
It just keeps getting more expensive.
Another doctor shortage
of all these new patients.
Florida.
The aging of the population.
There aren't enough new doctors.
Increasingly difficult to find anywhere.
Simply put, there aren't enough doctors.
I started a small business, Nurse Practitioner on Call, Comprehensive Care Medical Group, in 2010.
That's a heart beating?
That's your heart beating. There's a tremendous need within the community to provide this service.
They'll do anything they can for my folks, and I love that.
We go to places where other people will not go.
And this is the issue I feel like nurse practitioners can step forward to. We're used to working in environments like this.
The management of primary care patients is tailor-made to what a nurse practitioner can provide.
We're an answer to the problem.
That old-fashioned doctor or nurse conception is history. Modern advanced practice nurses are highly qualified to be primary care providers.
Most people don't realize how much education that these nurses actually have.
You're looking at 8 to 9 years total of studying nursing intensively.
Nurse practitioners are educated to provide this type of care, but yet we are required by the state of Florida to have this collaborating agreement. Collaborating agreements are not what everyone thinks they are.
This notion that there's a rigid hierarchy in how we do things is a false one.
When I work in the ER, there is no other physician in the hospital.
Collaborating agreement is a piece of paper that says a nurse practitioner is able to practice in the state of Florida. It's signed by a physician. That piece of paper is very costly. In 1 year, that cost me $50,000.
Many physicians are hiring nurse practitioners to staff clinics that they own, and the physician is not at all in the office. The nurse practitioner is practicing very autonomously, very independently.
A lot of physicians have physician extenders and they make a certain amount of money off of them.
That supervising physician may be run the state and they can charge any amount of money to do that. And we have this happening all over the states.
My first impression is very unkind toward that practice.
In the 4 years, I've spent over $250,000 paying physicians to sign my protocols, and none of them have ever seen any of our patients.
It's no secret that Florida ranks 50 out of 50 states in the most restrictive environment to do practice.
These laws have been in place since the 1970s, when nurse practitioners first started practicing in Florida, and they have never been changed.
As of 2015, there are now 49 states that have granted full prescriptive authority with DEA licensure to advanced practice nurses.
I practiced in Alaska where I had full practice authority. I also had a DEA for 2 through 5s.
There is nothing magical about having a DEA license, the ability to prescribe controlled substances.
My own daughter is a psychiatric nurse practitioner. She was born and raised in Florida. She was educated in the public school systems in Florida. She received her bachelor's in nursing and her master's in nursing in Florida, but she cannot work in Florida.
And this is a shame because Florida taxpayers are subsidizing state universities to train and educate nurse practitioners to be able to provide primary care in Florida. They're young, they're intelligent, and they see no reason to stay in a state that will not allow them to practice.
wants to know if we can help co-sponsor bills to increase access to healthcare via advanced nursed care, etc. Let's do it.
It's not about bottom lines and dollar bills. It's about people.
The National Governors Association could not find a single study questioning the quality of care offered by advanced practice nurses. Just last year, the Federal Trade Commission released a report citing substantial evidence that advanced practice nurses are safe and effective as independent primary care providers. This is becoming a national consensus.
Change is certain. You learn how to embrace it or become irrelevant.
It's unacceptable to keep us under the thumb of another profession.
Let's lay down all of the differences, come together and say, what can we do together to help our patients?
The people that sit in this room determine who has access to health care. That is a big responsibility.
Improving quality of care means achieving the AAA, which is giving the best care at the lowest cost to improve the quality of the health of the population. Doctors can't do this alone.
Henry, you donate a lot of your own personal time to come to this facility, I understand. Could you tell me a little bit why you do that?
It's just the right thing to do.
Advanced practice registered nursing is a profession in its own right. They are providers in their own right and worthy of being impaneled as primary care providers.
It just doesn't even seem like our political system is even working for us.